Welcome everyone, Dr. Mandell here. We are streaming live, and do I have a lot to share with you guys? So I've got like so much information that's really going to hopefully help a lot of people out there. But my main goal here is to try to run as fast as I can through this information with you. I really think that this will be a big asset for many of you. But first of all, we will be going into calcium. That's our big topic here. But there are other particular minerals as well as other fat-soluble vitamins that we'll talk about that work along with calcium. But first, let's talk about calcium. Then I'll see if I can get around to all the other things real quick. And if we have time, we'll bring people up on the platform depending upon how much time we have. Because this is a live stream, we will be getting a lot of people coming into the chat room, so just bear with us. Let's talk about calcium. Calcium, that is the main mineral that our body is composed of. And there's no doubt that we think of calcium, we think of bones, but there's a lot more than bones. Obviously, our body needs calcium for many reasons. It helps our heart, helps our blood vessels, it helps our nerves, it helps our muscles. There are calcium channel blockers that you might have heard about. And basically what that does, it opens the blood vessels so blood can get through those vessels easier, less stress on the heart, obviously lowering your blood pressure. So calcium does a lot of things. Now, you may be thinking of calcium like, okay, I have too much calcium maybe in my shoulder, maybe build up in the arteries, maybe in a different part of your body, which I will touch on some of those as well. So the key thing is, let's first talk about the suggested daily recommendation of how much calcium you should be taking or getting. I'm going to tell you it's anywhere between 1,000 and 1,200 milligrams. Obviously, as you get older, it could be a little bit more in the elderly, but that's why we hear of like hip fractures in the elderly that fall down because they have osteoporosis. So our objective here is, how can we prevent osteoporosis? How do we keep our body balanced? How do we prevent arteriosclerosis, atherosclerosis, hardening or clogging of the arteries? How do we get the right balance? And that's what I'm here for. Hopefully I can give you a whole bunch of good tips. Well, first of all, we look at calcium. Most people think of calcium as dairy, and you're correct. But there's a lot of people who are lactase intolerant or lactose intolerant that need lactase, the enzyme, to help digest, to absorb that calcium out of that dairy. So one of my favorite ways of getting calcium are green leafy vegetables. Green leafy vegetables are probably one of the greatest things. Broccoli, kale, collards, those are really, really good. Salmon is a great way. Your fatty fishes. And again, you'll have a lot of fortified cereals, even orange juices and stuff like that, that have calcium added to it. But it's always best to get it naturally. And I think that would be the best thing. So before we go into supplementation, I will talk about some things you need to be aware of. Well, let me just see if I can mention a few things with you. Many people who take calcium take sometimes too much. They think that more is better. You should never take a supplement more than 500 milligrams at a time. And if you take more, you need to spread it apart, because taking too much is going to excrete it from the body. And sometimes it can lead to kidney stones or other stones in different parts of the body that you're absorbing too much calcium. So you need to be aware that extra calcium is not healthy. And we'll talk about a little bit about that in a second. The next thing I want to go out, let me continue on calcium because I have a lot of information here, guys. Bear with me. The problem that I have with a lot of people who are trying to get calcium absorbed is that they're not getting absorbed, because a great majority of the world today are taking acid blockers, proton pump inhibitors. And as a result of that, they're not having the acid available in the stomach. Well, guess what? Calcium needs acid to be digested and assimilated into the bones. So if you're not assimilating calcium, you could be taking it all day long. Although that's usually calcium carbonate. There are different calciums, but the two main ones I want you to be aware of are calcium carbonate and calcium citrate. Now, the good thing about calcium citrate is you do not need acid to absorb it. So that's something that may be helpful for you. You can put that in the back of your book, the back of your mind, and that can be a great asset. Now, as I talked about calcium, almond milk. Almond milk if you look, you probably get half the amount of calcium just in one glass. So it's just a little tip for you. Again, tried dried figs, soybeans, and different types of beans. But I still will tell you that if you stay with green leafy vegetables, believe it or not, you are going to get plenty of calcium, I promise you. So that is something just do not forget. Let me just see what else I got here. Give me a second. So these are some important key factors that can affect how your body's able to absorb or not absorb calcium, particularly if you're taking it. If you're taking calcium with bran, remember these whole grains, if you're taking with bran, whole grains, I advise you not to do so because there's phytic acid, and phytic acid binds with calcium and other minerals. And obviously this is going to make it hard to absorb into the small intestine and into your system. Also, if you have a poor diet, okay, and you have lots of sodium, guess what, guys? I hate to tell you this, but if you are high in sodium, sodium also absorbs with calcium absorption. Sodium also interferes with calcium absorption. So now think about this for a second. How many people eat refined foods? Millions of people. We wonder why we're calcium deficient. We wonder why we're developing osteoporosis. We're not getting the calcium put into the bone because our diets are so high in sodium. And because they're so high in sodium, we're not absorbing the calcium. If you are a coffee drinker, a tea drinker, this works as a mild diuretic, and you could be excreting calcium out of your body. And one of the big ones, which I'll talk in just a second, is vitamin D. Because guess what, guys? Without vitamin D, you cannot absorb calcium. Let me say it again. Without vitamin D or enough vitamin D, you cannot absorb calcium. The biggest problem, if you're a smoker or even have celiac disease, which is an inherited autoimmune disease characterized by glucose intolerance, that could be a problem that you're not absorbing enough calcium. So now that I mentioned the greatest, most important vitamin, which is vitamin D, which is our fat-soluble vitamin, the problem with it is that the greatest source is coming from sunlight. But unfortunately, as we get older, very few of us have that sunlight. So as we get older, unfortunately, we are deficient in vitamin D, and most of us don't know it. Now, if you're having tiredness, if you're losing your hair, don't look at my hair. I shave my head. But if you notice you're always fatigued, you notice your immune system is very weak, you're most likely deficient in vitamin D. Immunity is huge with vitamin D. Think about COVID. Over 75% of every single case of COVID worldwide had a low vitamin D number, okay? And that tells you something. Now, if they had higher vitamin Ds, could it have helped you from preventing you from getting COVID? Maybe, maybe not. But could it have helped prevent you from dying? Absolutely. I can promise you that if your immune system is stronger, it can fight. Trust me, it has the white blood cells to do so, and it has those killer T cells. So vitamin D is so important, and it's the mediator that actually allows calcium to be absorbed into the cells. Without vitamin D, calcium can't get there. So something that you want to check next time you go to your doctor, get your blood work, get your vitamin D levels done, because of the fact that no matter how much calcium you're taking, you're not going to absorb it if you do not have vitamin D. That is number one. That's one of the most important things in the world. Vitamin D, they only recommend, 600, 800 IUs. Go at least 2,000, up to 5,000. I take 5,000. And I'll touch on that in just a second. So we know that vitamin D, we know that calcium helps strengthen bones. It's good for our teeth, but also it includes nerve transmission signaling. In other words, the nerves that are working through your central nervous system have to function and connect with the muscles. It allows us to move and think and work, and it allows muscles to contract. So even people who have excessive muscle contraction, possible arrhythmias of the heart, problems with blood clotting, blood vessel function, hormone release. Now, obviously, our body is filled with enzymes and hormones. So if these hormones are not working correctly, it can go right back to calcium. So we talked about approximately 1,000 to 1,200 milligrams And that's something I would stick by. But you're going to hear something from me, and you're going to say, well, why are you talking all about this calcium if you are telling us you really don't need to take supplements? And I agree with that. Okay. Now, for the majority of us, I don't think we need to take supplements. Why? Because we have so much variety of foods that we could absorb with all the green leafy vegetables, all the fortified cereals and milks, almond milks, all the fatty fish. We're getting plenty of calcium. Trust me, but we're not getting enough vitamin D. Okay. So for those people who are severely osteoporotic, who are known to have maybe hormone problems, who are taking steroids, maybe have autoimmune deficiencies, yes, your doctor may put you on calcium. If you have low calcium levels in your bones, through x-ray, when they go ahead and determine your numbers, yes, you may need to be put on calcium with other things as well. But if you eat your green leafy vegetables, because to me, I can tell you, I don't know if you agree with me, and I'm sure many of you will, there's nothing like getting the right nutrients from foods. Foods are the ultimate in everything across the board. There's no question. The problem is most of us don't eat correctly. And one important thing, magnesium. Guess what, guys? Girls, ladies, gentlemen, magnesium is essential because magnesium, and I made a note here to talk about this, now I might as well do it real quick, is that magnesium assists the activation of vitamin D. We're looking like dark chocolate, avocados, or nuts, legumes, or seeds, or whole grains, or fatty fishes, cacao. I did a little shorts on cacao powder, excellent magnesium. So you need to make sure you're getting enough magnesium, because the problem is the soils where we're getting it from doesn't really have what we think it has. I mean, how do we know if it's organic? How do we know what foods are coming from where? But magnesium is extremely important. It's works with over 400 different enzymatic functions within the body. It's probably one of the most important minerals, even though the fact that calcium is the most abundant, but calcium and magnesium work together. Now, another thing that just hit me. Okay, I got a lot in my mind. Is it wise to take your minerals together? Well, this is my opinion. You'll find a lot of formulas out there that have like a zinc, calcium, magnesium, vitamin D together. Okay, but in my opinion, from my research, I think it's okay as long as it's lower dosages. But some of those vitamins out there that have high dosages of calcium, magnesium together, they're going to compete for each other. And I don't recommend it. I always recommend to spread it apart if you can. So that's just a thought to be taken, because the fact the research shows that minerals like to compete with each other. And that is something. Now, let me go into something, the next things. I know where a lot of you are thinking right now. Okay. Vitamin K2. All right. Now, vitamin K2 is a fat-soluble vitamin. You have vitamin K1, vitamin K2. We're talking about vitamin K2. It's like vitamin D. It's stored in the body for future use. Now, remember something. These are not water-soluble vitamins, okay? Those conditions, those vitamins and that you're talking about, like vitamin C and vitamin Bs, those are water-soluble. The fat-soluble vitamins, the good thing about it gets stored in the liver and it stores in our body. But we don't want to become deficient because we need them at the times when it's most important. Now, vitamin K2 plays an important role in blood clotting and bone metabolism, but it also plays a very important role in cardiovascular health. It does protect against many cancers. And there is evidence, and there are studies, and I did attach an interesting article. Now, I'm losing my stuff in my computer here, but let me see if I can find it right here real quick, because I know I'm jumping around. And the article is called Proper Calcium Use. Vitamin K2 is a promoter of bone health and cardiovascular health. It's an amazing article. And what it talks about the importance that when you take vitamin K2 preferably with vitamin D, okay, I didn't say with calcium, with vitamin D. Vitamin K2 is like the director. The vitamin K2 is going to say, okay, guys, we need to put calcium where it belongs. We need to take away calcium where it doesn't belong. So what it does, it has a very specific, trying to think of the right word. It has a very specific mediator behind it. And I'm not going to go into the different names because it really doesn't make a difference. The medical names, I can talk, make myself look like Mr. Peabody, but that's not what I'm here for. But what it does, it says, okay, Mr. Calcium, you're going to the bones. And it's saying, okay, guys, we're making sure that this calcium is not going to our arteries. We're making sure it's not getting put into the arteries. We're making sure that it's not going to cause any blood clotting or any types of clogging of those arteries. So it takes it away from the soft tissue. We're not putting it in the kidneys. We don't want to give you kidney stones. We don't want to put it anywhere in the soft tissue, maybe in a joint or somewhere else. So it's very, very organized. And this is really great material. And while I'm here, let me just mention one thing here. The blood vessel produces a protein called MGP. We call it a matrix of GLA protein, which prevents calcium from building up on their walls and possibly causing those blockages that we're talking about. But the key thing with vitamin K2 is that it's essential to the formation of this MGP. So that clinical studies are there. In the article that I did attach in below, that you'll be able to see below the video, you'll be able to read it, because I did attach that with the research so you can see that. Okay, so remember, I do recommend, if you are taking vitamin K2, you want to take a formula called MK7, menaquinone 7, and that is something that I would recommend to do if you were going to take that. Now, just for that, what it's worth, there are other foods that I want to say, because I'm still a big believer. Remember, if you are a good eater, if you want to increase your intake of vitamin K2, the best way is through food, people. I'm not telling you have to supplement. Trust me. I'm really big with food. I'm not a big supplementer if we don't need it. I'm talking about people that really need it. But the best dietary source of vitamin K2 include meat. It's your dark chicken meat, your liver, your egg yolks, your dairy products like your cheese, butter, and your yogurts, and natto. The natto, that's the traditional Japanese dish made from fermented soybeans. It's extremely beneficial. You're going to ask me how much you should be taking. The average supplement's about 90 micrograms, anywhere between 90 micrograms and 200 micrograms. The supplements generally come between 90 and 100 micrograms. So I thought I would throw that good information out for you just so you have the knowledge. Okay? Now, we're moving real quick, and let me see where we're at here. The chat room's definitely building. So we're almost done here, guys. So we talk about K2, and I want you guys to look at that research article that I put in there, the importance of that. But I also want to mention something. I was looking at the chatters, and one of the fellows, I was just looking. I didn't respond back because I was trying to get all my stuff together. The question is what happens when you have this excessive calcium buildup in your arteries right now? You got plaquing. Yes, there's a lot of great elixirs that I put on my channel. And again, I definitely would ask every one of you, hold on one second, guys, to make sure you subscribe and share these videos. But I got some great videos to help reduce clogging of the arteries, just reducing fat. You know, a lot of my subs know the kind of stuff I have in there, so you need to check it out. But when it comes down to excessive calcium laid down, like calcific tendinosis in the shoulder, or maybe in the Achilles, maybe in the foot, in the arteries, in the kidneys, the bottom line is, what do? Well, one of my favorite things is apple cider vinegar, and I can testify to this because it's worked for me. I had mine went down to maybe 80% within like 4 or 5 months. I had a huge calcific in my change in the tendinosis of my supraspinatus tendon in my shoulder. I've put many of my patients on apple cider vinegar over the years. They've done wonderful. It's an amazing thing. Now, another great herb for you, Shanka piedra. Okay, guys, I will write this down. I will put it in the chat right here, and you catch it right here. Okay, Shanka, Chanca. Piedra, Piedra. They call that the stone breaker. You can get that at any health food store. You'll thank me later, guys. I believe that they not only have it in capsule form, but I believe they have it in drops as well. You can look into it. So that's something you want to consider. Now, another great thing for calcific changes in a joint, massage is good, moist heat is good, breaking it up. But from a nutritional point of view, the apple cider vinegar, diluted 1 tablespoon in a glass of water. You can add honey, add a lemon, whatever you want. I think it is a great thing. Yes, organic is the way to go. Organic apple cider vinegar with the mother, guys, with the mother. Very, very important. Vitamin D, we talked about, guys, important. Now, the reason why I'm so pushy on vitamin D, because we have a hard time getting this from our diet. Yes, if you're in the sun, you will get this. Yes, you can get a buildup in the gallbladder, by the way. Fellow talked about milk thistle. Milk thistle for the liver and gallbladder is very good. But the Shanqua piedra, as well as apple cider vinegar, can help that as well tremendously. I know a lot of people who are on that. But pertaining to vitamin D, we're really going to get this, as I said before, fortified cereals, your orange juice, your egg yolks, your fatty fish, your cod liver oil, milk, yogurt, mushrooms. But the problem is we're not getting enough. And that's the big problem, because even though we think we're taking nutrients and vitamins, we're not getting enough. Now, one of the most important things I did not say, and I apologize, when you take your calcium, take it with food. Okay? Because you're usually going to have acid in there already. It's going to assimilate. Do not take it by itself, unless you're taking calcium citrate. But most of us have calcium carbonates. All right. If you just came in and tuned in, I advise you, this will be put on my channel. You'll be able to listen back again. You need to listen from the beginning, because if you just came into the chat room, you missed a lot of very important information. Now, the other thing is, if you're taking a fat-soluble vitamin, like vitamin K2, which is fat-soluble, or vitamin D, which is fat-soluble, do not take it on an empty stomach, because you need fat to absorb it. So if you have fat in your diet, which you will if you're eating a whole meal, or if you want to have like maybe some milk with some fat, or yogurt with some fat, or eat some cheese with your fat, or whatever you have, whatever you want, you drink some olive oil, drink some avocado oil, eat an avocado. One of the greatest fruits on the planet is avocado. And avocado is the monster, because it's monounsaturated fatty acids, and it's great for your heart. It's great for your blood pressure. It's got lots of fiber. And preferably, your diet needs to be fixed. I can't tell you how many people I've come across who have all kinds of different types of conditions because of a crappy diet. Guys, get on it, because as we get older, our body is not the same. It starts to change. We need to start getting away from that processed food. You need to start getting away from those sugars. All right? I hope that this video will serve you well. And I wish I had more time to put you on the platform. But I will come back next day or so. I'll come back and we'll put you back on the platform. But for this video, and for our new people listening right now, I thank you for listening to this video. But this will be the end right now, because we don't want to make it too long. Anyways, I want to say blessings out there to everyone out there. This was a great program. I feel in here. You know, sometimes when we just give the good message, it just comes out right. I really think I got what I wanted to say out there. I really hope you utilize this. Please share us and subscribe, because there's only one thing I care about, guys. That's you, your loved ones, and your family. Because no matter what you have in life, if you don't have health, you have nothing. All right, guys. God bless you. Stay well, and we'll be back with you real soon. Bye-bye now.